Hi everybody. I want to do a quick video on an appointment that I had yesterday because I think it's important that we have a discussion around it. If you stick around to the end, I'll tell you why it's important for those of us that have had bariatric surgery to have this done. I'll break it down a little bit for you and it'll make perfect sense, I promise. Okay, so what did I have done yesterday? I had a deep tissue massage. Now, I am normally a relaxation massage girly. Not so much deep tissue because, to me, when you think deep tissue, you're thinking about the people that are just like really grinding into, your muscles and that type of thing. But honestly, I waited too long to have my initial massage post-op. The type of massage that I should have had within the first couple of months of having surgery was a lymphatic massage. And that's more of a lighter touch. They follow the lymphatic system. It helps with drainage and blood flow, and it's a really light touch. And they work around the abdomen, and like I said, they follow the lymphatic system. Now the massage therapist has to be trained on that. So it's very much a specialty massage. I know of one person in my area that is in the chiropractor's office where I go that actually does lymphatic massage, and she is always booked way out. So I have never had the lymphatic massage done, but I was having some issues, and so I needed to be seen, and that was my first opportunity was to book with Jessica, who's someone that's had their hands on me before. So I told her, I says, you do what you need to do, and I will let you know if I don't like it. So fun fact about massage therapists, they want to know all the things. They want to know what bothers you. What's the one thing that is bothering you the most? And what they are asking for is discomfort. Are you having, like me, I had neck issue and shoulder issues, a lot of that stemming from previous injuries. But, what other things are bothering you? Is it your legs, your hips, your feet, your knees, that type of thing? And because they want to be able to treat you accordingly. Don't be shy. Make sure that you let them know what you'll tolerate, what you won't tolerate. If you're ticklish, trust me, it'll not be the first time they've had somebody on their table that's ticklish. I'm only ticklish on the bottom of my feet. Don't tell Terry. But that's if you're using the light touch. Yeah, you know what I mean. And if you're having an issue with like a sprain strain, like in an ankle or a wrist or what have you, they're going to be very gentle in that area or avoid the area altogether, especially if you're healing from something like you have a laceration, you're trying to heal, you don't want it broke open, they won't go anywhere near it. So please make sure that you are being an advocate for yourself during this process. You want it to be an enjoyable experience. And yes, make sure that they know all the things before they actually get ready to go and work on you. So benefits of massage therapy: pain relief. It can help reduce post-operative pain if you're having it done not too long after having surgery. It helps decrease soreness by decreasing the muscle tension, and it helps improve the blood circulation also to the muscles and also the organs within the area. Helps lower stress and anxiety levels because, it's helped promoting relaxation during the whole process. At least I hope it is. Scar tissue management, as far as that's concerned, we're all going to have scar tissue. Whenever you cut the skin, there is going to be scarring. What that does, it helps some tissue, improves the flexibility of the scar tissue because scar tissue is not as flexible as normal skin. So massaging your incision areas. Now, I'm going to caution you, if you're brand new post-op, don't do that. Wait until your surgeon tells you you can. But if you do some light massaging over your incisions, you can help break down that scar tissue a little bit so it's a little more flexible and will aid in smoother healing, and your scars won't be as prominent. But don't do that until your surgeon tells you to, okay? Like I said, enhances circulation, promotes lymphatic drainage, even more so if it's a lymphatic massage, and helps speed up recovery. It helps your mobility as well. So, it was interesting. When she had me on the table, she was actually moving my legs off the table. Had me relax my legs into her arms, and she was like touching the back of my hamstrings, and also reaching under and working on my my thighs. And so she was like, you know, you're really tense. And I'm like, I know, I'm so sorry. And I did not realize just how tense my hamstrings were and my glutes were. And so she really worked on those before she moved up into the back, because she's like, all of this is connected in some way, shape, or form. She goes, so let me work on this. And so she did. She had me on the table for an hour and a half, and halfway through she flipped me over and then worked the rest of it. But yeah, so, you know, you're not as flexible as you were probably ever, because I've been overweight the majority of my adult life. And so now that I've, you know, moving more, my flexibility I'm recognizing is not where it needs to be. So she was helping me relax those muscles so I could be a little more flexible. And so massage therapy does help in that instance. Emotional support. I can't stress this enough, because it's it's supposed to be a relaxing process for you. And like I said, I hope it is, and it's not uncomfortable for you. That is so helpful in trying to keep you out of your own way. Okay, I think that is our biggest thing sometimes, is that we are so food focused because we can only have 2 ounces of this or 3 ounces of that. You know, we're stressed out at the end of the day. We are exhausted with thinking about all the things that comes along with bariatric surgery post-op. And, you know, we're trying to recover. We're trying to get our movement in. We're trying to get our fluids in. We're trying to get our food in. And what we forget sometimes is also we just need to take care of ourselves. And so I think having a moment to where you're not thinking about any and all of those things is very, very beneficial. So post massage, it's very important that you drink plenty of fluids. Now, I had my bottle with me, and she asked me, she tried to hand me a bottle of water. I said, I've got this. And she's like, yay, because you need to be able to push the fluids to release those toxins out of your circulation, your circulatory system, because as they're massaging, there's all kinds of things that are just getting pushed into your circulatory system. And the more fluids you push, the better you're going to feel the next day. You're not going to be as sore, trust me. So yeah, do it. I'm sore today, but not like the kind of sore I could have been had I not pushed fluids a little bit more. But you know, the soreness feels like just a little tender, but for the most part, and that's only because she really was digging into my neck and my shoulders. But yeah, I mean, I feel great. Make sure that you're resting and you're relaxing post massage. Trust me, you're going to want to anyway, because you're going to feel so good. And one of the interesting things, though, is that every time I get a massage, the one thing I want to do is stretch. And there is nothing wrong with doing a little bit of light stretching. Actually, that kind of helps promote that feeling of relaxation a little bit longer if you're doing some light stretching. Now, what you want to avoid doing is a lot of strenuous exercise. So I've started incorporating weightlifting into my movement now, and I decided, you know, I'm not going to do that for the next 24 hours to kind of give myself a little bit of a break. It's important to give your body a break. So I'm not doing my weightlifting for the next 24 hours. I'll do that starting tomorrow. Taking a warm bath or a shower is also beneficial. Now, I would normally kind of probably sit in a tub with some Epsom salts, but because she did most of the work in my shoulder and my neck, the shower was going to be the best bet for me, and it felt wonderful. Just listen to your body. You're going to know what's going to bother you the most. You're going to be very aware if you just take a moment and just listen to what your body is telling you. That way you have the ability to communicate more effectively to your massage therapist, and your recovery will be better post-massage. I'm not saying that you have to get a deep tissue massage. If you want a relaxation massage and you want a light touch, let them know that's what you want. But I recommend it. I highly recommend it. So here's the reason behind bariatric patients having had surgery, at least 6 months post-op at the very minimum. And by the way, there's a fly in my office, And it is the warmest day in October, at the end of October. It is probably the last warmest day of the year. And the dog let it in. And I'm going to get it. I'm going to get, drive me crazy. Drive me crazy. Anyway, short trip. So yeah, the benefit behind having massage therapy post-op, think about it for a minute. So, you know, like I said before, I've been overweight the majority of my adult life, and all my weight has been around my torso, my trunk, my belly. You know, oh, there he is. There he is. I literally put all my weight on from my earlobes down. Okay, so, but most of my weight sits in my belly. When you've lost weight, what you've done is you shifted your center of gravity. Okay, so you're not carrying around all this weight in the front of you anymore, or behind you, or wherever you had the majority of your weight that's coming off of you. For me, it's in the front. My belly was the biggest part of me. And so, you know, I'm down over 75 pounds. And so that has shifted, and I'm walking different, standing different, sitting different. And I'm feeling it now. And because it was bothering my neck and my shoulders, I even had to get a new pillow for my bed because it bothered my neck so much of how I was holding my head. Now, little tip, tech neck is a real thing. So those of us that have cell phones, which is the majority of us nowadays, have a tendency to hold our head down like this when we're looking at our phone. So what does that do to you? That curve in your spine, there's a curve at the base of your skull. Your spine has to be curved a certain way. And that curve is starting to go missing in a lot of people. And people are now more head forward instead of having their head back. And trust me, if you're gotten this far into the video, you're going, oh yeah. And so when you can consciously think about it, make sure that you're putting your head back, your shoulders down, your shoulders back. And you're going to go, ooh, I feel the stretch. And so, yeah, technique's a real thing. If you start missing that curve at the base of your skull, you're going to end up getting what I call a Quasimodo hump, and that's no fun. It's very uncomfortable. You're going to start looking at the ground by the time you're 80 years old, and that's all you're going to be able to see is the ground. But anyway, so you are shifting with how your body is moving, and the weight has to go somewhere. So your body adjusts because it's such an amazing thing. So you have to basically start retraining your core. And do strength training exercises for your core and balance training, because you're going to have to learn how to balance yourself all over again. Things are shifting. So that is why it's important for a massage therapy to come into play, because it kind of helps you adjust your muscles and relaxes them and kind of it resets everything. And so, yeah, massage therapy is, I think, a really good tool for recovery post-bariatric surgery. So that's basically all I got when it comes down to the massage therapy part. But fun fact, when I don't have an appointment, I have this. And by the way, this is a lacrosse ball, and he matches Doug. Doug is my Doug from Up. He's my squirrel, Doug. He's a squirrel. This is a lacrosse ball. My chiropractor gave this to me a couple of years ago. And what I do with this, because it's not like a racquetball or a tennis ball where it's kind of squishy, it's pretty firm. You could probably use a baseball or a softball if you wanted to, but they're not as smooth. You put it between you and the wall, and this is how I kind of roll my back out in between massage appointments, and it feels so wonderful. It kind of helps immediately kind of relax those muscles back there. You can also feel the knots as they develop, because I do sit a lot for my job sometimes, and when I start feeling it, I just pull it out, get up against the wall, and start rolling my back. I also use a chirp wheel. Your spine needs to be able to move. If your spine is not moving naturally, then you're at risk for developing arthritis in your spine. But don't use a chirp wheel if your doctor advises against it. Look it up. Take a look at it and on how to use one on YouTube. You can find all kinds of things on YouTube. It's an amazing tool that my chiropractor gave me, and every time I get on, I hear my spine go crack, crack, crack. And it feels really good. But it also kind of keeps me moving and keeps things kind of adjusted, my chest and my back. And it's wonderful. So my chiropractor office also offers functional fusion. And so I grabbed this pamphlet while I was there, and they have IV therapy, regenerative therapy, and peptides and compounds that they can also offer injections, hormone therapy, and functional medicine. What's really nice though is I have a functional medicine medical director, so I get all that stuff from him. But also my bariatric surgeon is someone that is very much about functional medicine, so I don't have to worry about paying money for additional a complete panel for labs and stuff like that. But they offer IV therapy for one's called Vanity for healthy skin and nails, but they also can give you peptide compounds for fine lines, wrinkles, and collagen production. I'm still in my hair loss era of the weight loss journey. As you can tell, I've got some bare spots, and I'm really considering it. And if I do consider that, doing something like this, then I'll let y'all know how it goes. I'm super excited about that. So yeah, that's all I've got. I wanted to kind of put that out there into the universe and just kind of let you know that definitely use massage therapy as one of your tools in your tool belt. I did, fun fact, also lose 2 pounds last night as a result of having massage. And I'm going to say that between the massage and all the water I drank yesterday, I do drink quite a bit of water on the daily anyway. The combination of the two probably helped me break my stall, because I've been in a stall now for a couple of weeks. And so that was exciting. And that was a benefit I wasn't even looking forward to. So anyway, I'm not saying that's going to help you, but it did help me. That's all I have. And if I have any more fun tips for you, I will come back and share them. Y'all have a great day, and I will talk to you soon. Bye.